A lot of people can injure their knee just by falling over or twisting playing sport. In many cases, this could just be a simple soft tissue injury, something that you could call a knee sprain, and that could be just a small tear of one of the ligaments on the side of the knee, or a bruise, or a hematoma, and this will settle by themselves with the usual treatment of RICE, which is rest, ice, compression, and elevation. However, it's quite hard to tell whether you've just got a simple knee sprain or a more serious injury, which is why we'd always recommend that anything which is quite painful, stopping you from walking properly, gets assessed, because you could have one of these injuries, which includes a shock absorber tear, so-called sportsman's cartilage, which are the menisci, which sit on top of the shin bone. And if you twist your knee, you can tear these shock absorbers, either the inside one or the outside one. You could tear a ligament properly, either a collateral ligament on the side of the knees or one of the cruciate ligaments, which is inside the knee, stopping the shin bone from going forward or backwards on the thigh bone. You could also tear one of the muscles, such as the quadriceps tendon or the patella tendon. And if you have a really serious injury, which tends to be more high energy, you could dislocate your knee when you can rip more than one ligament. Your knee would tend to be quite unstable. You might even have some pins and needles at that stage, and those sort of injuries are normally seen quite quickly in the emergency department. But I would just want to warn people that not just to think they've just got a simple knee sprain if they're having difficulty in walking or moving their knee properly. I think if you've got severe pain and you've got swelling of the knee, difficulty in standing on the leg or moving your knee fully, and it's not resolving just with a few days of rest and ice, then you've got to think, well, this is not getting better quickly. And if you've got these specific symptoms, such as locking, that's when your knee won't fully go straight or won't fully bend. You just feel a block in the knee. That can be a sign of a shock absorber tear. That's a displaced bit of cartilage in the wrong place. And then the other one is giving way. If your knee just suddenly gives way on you, it can be because of pain, which inhibits the muscles and the leg just collapses. Or it could be because you've torn a cruciate ligament, and normally the anterior cruciate ligament is the most common, and that should prompt early review, really. Common sense things like putting your weight on the knee and then just checking you can bend it as much as the other knee is. And if it's improving, we've all knocked our knee, doing sports as children and adults. So, if it's not getting better within a few days, then, you need proper assessment. Particularly if you can't lift the leg up properly and you're getting those locking or giving way symptoms that I have said before. So when you do go and see a medical professional or a physiotherapist, they will do various tests. First, they'll look at the knee. They look for what we call an effusion. That's just a big swelling in the knee, which is usually caused by blood if you've had an injury to one of the structures inside the knee. They'll feel for the swelling, because you can check how much swelling is in the knee, and then they'll assess the movement. First, we'll see how much you can do yourself, lift your leg up straight, how much you can bend, and then they'll try to straighten and bend it themselves. And then there are some special tests for the shock absorbers and the ligaments. So for the shock absorbers, we'll often feel in the joint line of the knee, see if there's any pain. We might twist the knee gently and to see whether that causes pain. And for the ligaments, we can gently try to move the shin bone away from the thigh bone gently in various directions, just to see if any of the ligaments which are around the knee are slightly loose. And based on that, we'll have quite a good impression of what you might have done. And we need usually an X-ray, and then the next stage is usually to book an MRI scan. This question's become even more important during the pandemic, because we've been seeing people very late because people couldn't access treatment often, or felt best to stay away from hospitals. So I really would encourage people to come in and get their proper assessment, because what can happen is that you can make a problem that could be fixed, such as a shock absorber tear, into one that we can still address, but we might have to remove a bit of cartilage rather than repair it, because over the months, that cartilage tear has become deformed within the knee and it's difficult to repair. So say you take the common shock absorber tear, it's fairly well known that you need to operate within about 6 weeks to have a good chance of repairing it. Otherwise, you're looking at resection. And if you resect a shock absorber rather than repair, that means remove a shock absorber, you're increasing the risk of wear and tear in later life. With ligament injuries, such as your anterior cruciate ligament, which is probably the most common one that we operate on, you won't be able to return to sport probably, particularly if that's a pivoting sport. And because there's such a lengthy time to recover anyway following surgery, you're really increasing that time and the deconditioning before you get back to what you want to do. So I think it affects lifestyle. And if your knee's unstable, we find that sometimes people can't work and they can't do their normal activities. You know, I think the biggest worry is worsening any damage to your knee by walking on or trying to play sport on a knee that's not been properly assessed. You've got to think to yourself, is this serious? Can I not walk? If you can't walk on it properly and your knee's very swollen, then it needs to be assessed early. I think it's best that medical professionals decide whether it's a simple knee sprain and we can just try ice and compression and elevation, or whether we need to investigate further. It's notoriously quite difficult in the first day following a knee injury to assess it properly because there's pain, there's swelling. So it's quite good to get into the system early and arrange follow-up so that your knee can calm down a bit and the medical professional can assess you after a few weeks. Then, you know, I'll often be able to tell, oh, that knee's settling down. It's unlikely to be any major problems. But if it's still then unstable, those tests we talked about earlier are easier to perform after a couple of weeks. So, you know, you certainly want to get early assessment and then you want to be followed up and you want to get to your MRI scan, if that's what you need, fairly early, because we know now that the quicker we can deal with injuries, the better. And so just be really careful about self-diagnosis, about I've just sprained my knee, it'll get better by itself. You know, that's fine. If it doesn't get better in 2 or 3 weeks, need to try to get an urgent assessment.